It's Mari McInerney from Croaky here, and we're at the National Climate Emergency Summit in Melbourne, and we've just had a session where we had 4 doctors and doctorate students stand up and talk about climate change and health, the climate emergency and health. Chris, could you introduce yourself and what you did in that presentation?
Okay, well, I'll introduce myself. I'm Dr. Chris Moore. I'm President of Australian Medical Association South Australia. I have here Professor Julian Rait, who's President of AMA Victoria. We have Dr. Tessa Kennedy, who is representing AMA New South Wales, and also the chair, and she's also the Chair of Doctors in Training, and Daniel Zou, who's the President of the AMSA, which is the Australian Medical Students Association. The reason why we're here really is to really spread the word that the AMA does firstly have a position on climate change. We also walk the walk in that we have a position statement on sustainability, and last year we declared, and this is important, we made a declaration that climate change is a health emergency based on science. And this really arose out of an important thing because it is something that's urgent, but also the fact that we walk into policy, we do a lot of policy work with government and with other policymakers, and I was shocked at various times when people didn't realise that climate change is a health issue and it's a material issue for a lot of people. And I think the first thing is we have a code of ethics. I'm a doctor. Whenever we speak to our patients, we have to care about them and actually be brave enough to say the truth about what's going to happen and do things that are relevant to them, that's going to improve their health, and it's got to be based on science. And that's probably the first thing I'd say. Other thing I'd say is that in recent times, a lot of people feel that climate change is too big a thing. And in this conference so far, we've been talking about sort of this, we need a warlike response to health. Can I just say, having been involved in it myself just recently, the response to the coronavirus and the sort of work in terms of the army being mobilised, AUSMAT, quarantining, that we've put people on Christmas Island, we've closed the borders to a degree. These are all things that are warlike things that are based on science, and we can do it. And I think that's an important message. But look, the health effects are really huge, and I'll pass on to Dr. Rait to talk a little bit about that.
Thanks very much, Chris. It'd be great if we can come back and talk a bit more about that wall footing we've been talking about. Julian.
Thank you. Equally, I think that we're here because we wish to combat climate denialism by using the evidence that we see, not only about climate, also about the emerging risks in health. The unfortunate reality is that escalating global temperatures will result in a catastrophe for the health of humanity. If we see a 4 to 5 degrees Celsius rise, as has been predicted by NASA by the end of the century, there will be dramatic escalation of health-related deaths. We believe that in accordance with that data, that there could be hundreds of millions, if not billions, of people who will die a premature death because of climate change and escalating temperatures. And this is quite apart from those who might die from disasters like catastrophic flooding or bushfires and other secondary consequences of climate change. Global warming increases the risk of a whole host of diseases, particularly viral bacterial infections, but also things as diverse as parasitic infections or protozoal infections, things that perhaps might occur from the overflow of sewage during floods. Equally, Legionnaires disease is much more prevalent in hot and humid conditions, and I can only see those sorts of risks dramatically escalating over the next century unless we address climate change urgently. We believe that this catastrophic effect that's coming down the line to humanity can be avoided with appropriate mitigation, and we're calling on government, of course, to really seriously consider dramatic mitigation strategies to try and reduce CO2 emissions, methane and nitrous oxide emissions, because we believe that those are all things that can be controlled with appropriate technology. As has been suggested by Chris, that we think it's something akin to a war footing, that with appropriate technologies and strategies things can change and we can alter the trajectory that we seem to be set upon at the moment.
Before we go on to Tessa and Daniel, a lot is made of the fact that the medical profession is one of the most trusted, and that the AMA is a very influential beast, as we know through many discussions. Are you getting traction with government? You've been out there speaking about it.
Well, the disappointing thing, I think, is that we don't see the sort of bipartisan support for this issue that is seen in other countries, notwithstanding that other medical associations in other jurisdictions have tried to progress this. We, and probably the Americans, are kind of alone in the fact that we don't see bipartisan political support for initiatives to reduce or dramatically reduce our carbon footprint. So the answer is we keep trying, and I think that the AMA is very much committed to an ongoing dialogue with government about this very concern.
Thanks very much. Now I'm just shifting over and moving the microphone. Thank you very much, Tessa.
No worries.
What were your main points you wanted to get across today to this audience here?
So I suppose as doctors every day we rely on scientific evidence to make the best decisions we can for our patients, to improve health outcomes, to frankly save lives. And climate change and the climate emergency and its impacts on health that Julian has in particular detailed should really be no different. We're not climate scientists, but when my patients walk in, they trust me as the clinician who is expert in health science and medical science to help make decisions about their health. So if someone looks like they're having a heart attack and I say, based on the best available medical evidence, you're having a heart attack, here's what you need to do, most people go, okay, I will probably do that because that makes sense. You know, I believe the scientific body of evidence that leads us to those conclusions. And again, I don't really see why climate change should be any different. We have overwhelming evidence that there are incredible threats to human health as a result of our changing climate, that unless we step up and do something about now and start embedding in all of our policies across all facets of life, from transport to water management to energy use to frankly healthcare itself, which is a big carbon emitter and a big source of significant contributions, not just through carbon emissions but also our anaesthetic gases, etc., that contribute to climate change. Unless we address these very modifiable factors in our lifestyles and in our society, we're not going to be able to mitigate these health impacts. And frankly, as doctors, we would not be meeting our obligations to safeguard human health if we didn't speak up for this and if we didn't demand action from right now when the health impacts are real.
And Daniel?
Yeah, I guess the main point that I kind of really wanted to bring to the conversation is really ensuring that we have evidence-based strategies that are embedded within public policy. It's extremely important that we have a national strategy going forward to combat climate change, but also the health impacts of climate change. We need to make sure that the health impacts are always at the back of our minds when it comes to talking about policies, regulation, and legislation in all instances, and ensuring that we're weaving it all into public policy. And that way, and to that extent, it almost becomes a bit of a responsibility for everyone. We've all got we've all got a part to play. For us, it's in the healthcare sector, as mentioned by Tessa, but we need to start in our own patch and look forward and trying to get our voices out there to ensure that the health impacts of climate change is clear.
Do you think that's going to mean a shift in training, education of the medical profession? Is there enough focus on climate health?
Daniel's in medical training right now, so he's probably got a more up-to-date view of exactly what is embedded in curriculums. But I think certainly, as a doctor, working in the field now, I think that there is an awareness that this is a problem, but there is a difficulty in translating that kind of general awareness that we need to do something into what is it that we actually do. And I think we can very much start, in our own patch by trying to improve, our energy use practices, our waste reduction practices, and as Daniel has highlighted, really recognising that decisions that we make in fields of public policy outside of health do have health impacts. There are many social determinants of health, and as the AMA and as doctors, we think about health very holistically, and so I think that is a principle that is very much taught to us from day one of medical school, and that, yes, probably increasingly we'll need to have greater teaching and awareness of how all these interrelated kind of systems work together to help or harm health, and how we need to respond to the threat that climate change poses to global health. In fact, the WHO has declared it the greatest threat to global health in the 21st century.
Daniel, are you getting lots of that information in your training?
Yeah, it's a really good point to raise, and I think it's something that's growing within the medical curriculum, that there's an increasing shift where we're having a little bit more about public health and climate change and the impacts, and really connecting up the dots. And I think that's something that needs to be increased in the future going forward, having the ability to expose medical students and the future medical workforce to these ideas and concepts, and also to allow them to be cognizant of the fact that in the future they'll be dealing with potentially the impacts of climate change and the health impacts. And this is far-ranging. This goes from bushfires, smoke inhalation, all the way to floods and communicable diseases, and even the longitudinal impacts to community and the fabric of communities in rural sites and metropolitan cities. It's widely important that medical students and the future workforce is cognizant of this.
Thank you very much. Now, I know everybody's heading to the next plenary session, so I'll just go back to Chris and Julian about this idea of going on a war footing. There are concerns about that some people have expressed concerns that that's going to start looking at big authority type responses that could cause other problems for us. Is it a worry for you, or do you think it's just an analogy that just works particularly well?
I think the recent events and having been involved in it kind of made me realise it's doable. Look, I think sometimes dealing with climate change and responding to it seems like a mountain that's too hard to climb. But having been in health and just seeing what's happened, even with the coronavirus, which hopefully won't be a huge threat, but it may be, what has happened recently, for example, all the infectious disease and health services in every state and federal governments have got together. There's a national war panel virtually with regards to decision making in terms of what to do about that, in terms of how the health services are going to work. But beyond that, then we've had border protection with Peter Dutton walking in, talking about, and they've talked about how they're going to bring people back and quarantine people on Christmas Island. In effect, the Army's been brought in, and AUSMAT has been brought in, and we've also had other organisations having to be part of this whole fabric to actually make sure that things come together. So it is possible, and that's the message. It is doable, and that's the sort of response, that coordinated response about this, and it obviously needs to be bigger. We need to break it down to chunks like this. So the first message is it's doable. The main message for the community, and I think we need to bring it down, it's not just about climate change, it's about health. It is a scientific issue. We as doctors who walk into every day, give you this information, we need to base it on that. It's doable, we've got to apply the same response. And let's just focus on that issue, because it's a big one that affects every single person in Australia.
But what would the health profession on a war footing look like in terms of climate change? What would have to happen first to really ramp that up now?
Yeah, I'm happy to.
Sure. Well, first, can I say that just this is really an analogy. I think obviously an authoritarian response in the full sense of a war footing is probably inappropriate, because the only way you're really going to effect proper change is by engaging with the community and having them move on the journey with you to change their behaviour, because to decarbonise the economy will require considerable behavioural change by the population. So I think that where the analogy holds up, though, is that what we've seen with the coronavirus response, we've seen sort of good science being applied to very sound public health measures. And what we're really seeking in the instance of the global health emergency arising from climate change is we're seeking the same sort of science-based proactivism. It may surprise people to know that in the background of all this coronavirus responses, there's quite a lot being done in pandemic preparedness. Australia's probably about fourth in line in terms of how well prepared we are, but many countries, the United States, the UK, Canada and others, have actually gone to some length to actually have strategies in place, including further scientific investigations ready to look to how to manage specific threats. It's sad, I think, that we don't have the same with climate, that because it's a much sort of longer term threat and not such an immediate change, people are not really thinking the same way. And that's where I think Chris is right. If you put people on the same footing and have the same intellectual concept that they have to actually develop some mitigation strategies fast, then I think we will lose this battle, and obviously that has great implications for humanity and for the species of the planet we're supposed to care for.
Thank you very much to you all.